Good afternoon, dear colleagues. It is my great honor to participate in this great symposium, and I would like to thank the invitation by Professor Kuresiva for the kind invitation. And today I would like to share with you on the topic of personalized confidential level of artificial intelligence in predicting retinal diseases. My name is Haoyu Chen from Zhuangzhou International Eye Center, China. So as we know that retinal diseases have a very high prevalence and it may cause irreversible blindness, and there's high demand of expertise in diagnosis. However, there's always lack of the expertise in many rural area, and it has been shown that screening based on retinal imaging grading can reduce the blindness caused by diabetic retinopathy, but still manpower are needed for human grading. So recently, artificial intelligence has been applied to automatically classify the image of retinal diseases. However, there's a problem of the traditional artificial intelligence. There's the overconfidence, and in the real world, it is very complex of the healthcare, and some cases may be simple, but some are difficult. So in clinics, our young doctors would refer some difficult case to senior doctors, which may prevent the misdiagnosis. However, the traditional AI cannot express its confidence. So it is overconfidence, and it only give a result of that this image maybe is a normal, and this image is a diabetic retinopathy, and there may be some mistake. And if we use the classification result of the AI directly, there may be risk of the misdiagnosis. And if we performed it a double check by ophthalmologist, then it is a low efficient. So can we try to train the model to express the level of confidence in predicting retinal diseases? So we developed this model and using the technique called uncertainty estimation. So in the first part, I would like to introduce our work on fundus photo, and in this work is use the uncertainty to express the level of confidence and apply in an open set learning scenario. So this is the study design, and we train the fundus photo of 9 categories, including normal and A diseases. And in traditional model, in traditional AI model, the AI model can give the probability of the 9 category. And if the patient, the testing imaging of the patient are within this 9 category, then the AI may give a correct prediction. However, if the testing imaging is outside this 9 category, the AI haven't learned it during the training, then it still output a probability of this 9 category, then it is a mistake. While our model can output the uncertainty, so we can output the uncertainty level beside this 9 category. So if the model is confident in this image, then it will output a low uncertainty score. Then we know that this prediction is correct. And if the testing image is out of this 9 category, then the model will output a high uncertainty score. So then we will know that this prediction is unreliable, and then we need to refer to ophthalmology for double check. So we set up this data sets of the target category, which have 9 category, and we have the internal set, and then we have external set, and we also have some sample with untypical features, and which we call it the unseen data set. And we also have this non-target category, which is out of the 9 category, and then we have these 3 data sets, And we also have some non-fundus image, and which are the OCT, OCTA, and natural image. And this is the definition of the typical and untypical dataset of these 9 categories. And we also included this non-target category dataset. And this is the model. So besides the classification, we also can output the uncertainty score from this distribution, and then we can use this loss function to optimize the model. And we have this thresholding and category calculation of the uncertainty. So if the uncertainty score is higher than this threshold, then it means that it is unreliable. So this is the result that we have. This the performance of our model is better than the traditional AI model, and we can see that our model, the F1 score is 97% compared to 92%, and in the external data set it is 87 compared to 80, and in the untypical data set we are 78 compared to 64. And then our F1 score get further improvement after the thresholding. And this is confusion matrix. We can see also that our model have a better performance compared to the standard AI, and get further improvement with the thresholding technique. And this is the ROC. Again, our model performs better compared to thresholding, compared to standard AI, and get further improvement after the thresholding. And this is the result of the distribution of the uncertainty score. So we can see that in this validation set, that most of the sample are below the threshold. And in the internal data set and the external data set, and also the untypical data set, we can see also most of the sample are under the threshold. However, in the non-target dataset and also the low quality dataset and the OCT, OCTA, and natural image dataset, most of the samples in this dataset are higher than the threshold. So it suggests that our model can recognize that this sample, the prediction of these samples are unreliable and need a double check. So here is some example. So we can see that this is target category image. So this is diabetes retinopathy, and the model has learned this disease during training, and we can see that the standard AI model is correct, and our model is correct also, and we have a low uncertainty score, but in this image of the AMD, it is quite untypical, and the standard AI model have classified as a CSC, and it is a mistake. And although our model is also output as CSCR, it output the uncertainty score of very high, and indicate that this prediction is unreliable and need a double check of ophthalmologist. And so this is two image with haven't learned during the training. That's our non-target data set. So we can see that it is not in this category, and the standard AI model is make a mistake when predicting these two image, and our model output a high uncertainty score and indicate that the prediction is unreliable. And also for the OCT, OCTA, and natural image, And our model also output a high uncertainty score to indicate that the prediction is unreliable. And compared to literature, there is some article reporting the abnormality detection. However, they are trained with normal image and detect abnormal image. They cannot further classify that the abnormal image is as a which disease. And there are also some uncertainty research in medical image, mostly are based on the Bayesian uncertainty, and our model is based on the evidence learning. And most of the literature was based on applied it on image segmentation or binary classification, while our and some may applied it in multi-classification, but not for detection of the of category image. So our model was the first one to apply this uncertainty estimation in multiple classification, especially on detection of the OOD data. And our model work like young ophthalmologist. So in young doctor, when they were trained with some common retinal diseases, and when they see the patient with the disease they have learned, they can make a diagnosis with confidence. However, when they see the patient with the disease they haven't learned, then they will refer the patient to a senior doctor. And our model mimics the young doctor that when they see this disease haven't learned, they will refer to ophthalmologist for double check. And we developed a new loss function and new strange holding strategy for in the algorithm, and we have a new clinical application. And we also recognize some limitation because we still need some manpower to read high uncertainty image, and we need more category of retinal diseases in the training, and image with high uncertainty score will we inspect it, and also we will apply our method in other modality of medical image. So this study was published on Nature Communication last year. Then the second part, I would like to share with you our study on the OCT image, also using this uncertainty estimation. And besides the uncertainty estimation, we also use this foundation model, the RETFound, which was published again last year on Nature, and they use this self-supervised model measures and have very good performance on OCT classification. So we would like to combine this RETFound and our uncertainty estimation together to take the advantage of both techniques. So this is our study framework. So we use some label. So in the pre-trained RETFound model, they were trained with lots of OCT image, and we further use some labeled OCT image, and then to fine-tune the RETFound model using the LoRa technique. And then we also apply the uncertainty estimation measure, and so that the model can output uncertainty and the prediction. Besides the prediction of this 16 category, it will also output the uncertainty, and then we will apply it in the clinical setting, and then it can output the probability of this 16 category, and also the uncertainty score. If the uncertainty score is low, then it suggests that the prediction is correct. And then if the uncertainty score is high, then that it suggests that the prediction is not reliable. So this is the result that, again, the results show that our methods have have the best performance in the internal testing set, external private data set, and also the external public data set. And this is the distribution of the uncertainty score. So we can see that in our model that most sample in the validation set, internal testing set, external private and external public set have low uncertainty score, lower than the threshold. And for the non-target category data set and low quality data set, that most of the sample are higher than the threshold. And so here we can see that in this figure, that when we excluded the samples with high uncertainty, then the accuracy of the model is increased. And we also compare our model to ophthalmologists. So we can see that the F1 score our model is here, and which is much better than the GPT-4V. And we are also better than the retinal experts, which have a average accurate F1 score here, and also than the senior doctor and junior doctor. And here so some examples. So for example, this is retinal detachment, and our model can recognize it very well and have a low uncertainty score. But for these two images which have untypical feature, then our model can output a high uncertainty score and to indicate that it is not reliable. And for these three images, and two are some very rare diseases, lymphoma and colloidal tumor, and our model also output a high uncertainty score. And also for this low quality image, it also output a high uncertainty score. So our model have a high efficiency of uncertainty estimation. The risk of misclassification was 19, 32, 9, and 16 for the image with high uncertainty in the internal set, external private, external public, and human machine comparison dataset respectively. And exclusion of the high uncertainty sample can improve the model's performance. And the performance of our model is better than RETFound, and because we introduced the uncertainty estimation, and we are also better than UIOS because we use RETFound as a backbone and fine-tune using LoRa. And we are also better than doctors because doctors usually use 3D data of OCT, and the doctor will usually integrate the information from other modality of imaging and also the history to make diagnosis, and also the doctor may be subjective. So in the overall conclusion is that estimation of uncertainty represent the confidence level of AI in predicting retinal diseases in individual images. And the UIOS and FMUE can recognize the out-of-distribution samples not seen during training, besides the classification of 9 or 16 common categories, and provide a robust method for real-world screening of retinal diseases. So I would like to thank my collaborator and my students and my seniors for their contribution in this work. Thank you very much.